I'm Elena Marino, a cardiology fellow in Nassau University Medical Center, Long Island, New York. And today at ACC 26 here in New Orleans, I have a pleasure speaking with Dr. Sasha Opotowsky, who's serving as a program director in Cincinnati Children's and has been in the forefront of congenital heart research, particularly specializing in pulmonary hypertension and exercise physiology. Thank you, Dr. Opotowsky, for taking your time and speaking with us. And I wanted to start by asking you a question about the growing field of congenital heart disease. It's been a lot of programs has been opening around the country in multiple centers. And how do you think this rapid expansion shapes the landscape of the congenital heart disease care and training, let's say within the next 10, 15 years?
Thank you, Lena. I don't know that I'm on the forefront, but rather, like you're saying, with this rapidly growing field on the crest of a wave with others moving forward, which has been a very exciting last 15 years. So the field really has grown as natural expansion of more patients surviving longer. And it has, I think for the last 15 or 20 years, has probably grown, most programs have grown 5, 10, 15% per year naturally. And that won't persist forever, simply because there has to be a plateau of how many patients are born with congenital heart disease. But it does come with a lot of real opportunities for expanding the program and what we offer. We have for decades and decades, since the 1990s and the first guidelines, recommended that all patients with congenital heart disease who are adults have at least one visit with an ACHD specialist, and that includes even the simplest diagnoses. And that clearly hasn't happened and hasn't been able to happen. And that will become more possible over time. And programs, things that we have said we wanted to do, like transition programs, having psychologists embedded within our programs, become more and more feasible as our population grows and each program gets to a critical mass. So I see an amazing future for our field, sort of fulfilling many of the promises that we made in the past. Obviously, technology is another huge impetus, both biologic and device oriented, and that's also made great progress. So very exciting times.
Yes, I agree. Thank you. And shifting gears towards research, there has been growing body of research, including multiple registries with congenital heart disease patients and even clinical trials that's gonna come out within the near future. But usually study results are limited by small sample size and unique anatomy of congenital patients. How do you think these limitations impact clinical decision-making using the research outcomes that we have in patient care?
You just have to use your imagination, creativity. No. So I think it really is a challenge. I probably shouldn't say this in an ACC program, but it really emphasizes what you can do without evidence and how people's understanding and experience makes a huge impact. Pediatric cardiology in its early years for decades made enormous progress that we've seen has been successful, obviously with fits and starts and trial and error with real consequences for people. But they have made enormous progress, and ACHD has made enormous progress with the limited evidence that you speak about. And I think we have to acknowledge that clinical care, even in the absence of really hard evidence, can improve over time. But you're right that the evidence base has been challenging, and it's been easy for people to use their imagination, not just in good ways, but also in bad ways. And that is sort of to confirm their own biases and opinions, which is not always ideal. And so there has been a growth in multi-center collaboration over the past 15 or 20 years, which has been fantastic. And it actually is one of the great things about the field. It's a small field, collegial, and really starting to collaborate more and more. And centers have been developing registries, patient-oriented registries, disease-oriented focus registries, which I think will make a big difference. And the relationships we're building between centers that will allow clinical trial enrollment and further advances, I think, really will transform the field in the next 10, 20 years.
I think it's amazing. Good times are coming into congenital heart disease. And
as they say in New Orleans, let the good times roll.
And just the last, question I would like to ask, if you share some words of wisdom for trainees who would like to pursue congenital heart disease as their career goal.
as long as no one who knows me is not listening, or I hope nobody who knows me is listening, because otherwise they would tell you not to ask me about my wisdom. I would say, so the wisdom that I got, there was a wonderful mentor at the University of Pennsylvania when I was there, Martin St. John Sutton, and in his thick British accent, asked, "Do you really want to do this field?" That wasn't his accent, by the way. I mean, make half as much money, you work really hard. And he sort of spoke like that with a mix of Philadelphia and British. And the reality is it's a great field to be in. It is very rewarding. The patients are wonderful. And that is really why I got into it. I did a research project and ended up, I think, at the 2004 Adult Congenital Heart Association meeting in an airport motel in San Francisco, if I recall correctly. And I remember whatever it was, there's a 3% mortality, and all of a sudden giving this research presentation to patients, all of a sudden the 3% mortality meant something a lot different. And it wasn't necessarily true, but it is true that the patient population is enormously supportive, really pushing us forward and coming with us. And both in clinical care and research as a community, it's just a really rewarding, excellent field to be in.
Thank you. Thank you so much for taking your time and speaking with us. For more videos like this, please follow youtube.com/fitsonthego.